Many of my patients are in the perimenopause or menopause, and in my view, this is one of the most overlooked areas in modern medicine. And that's slowly starting to change, thankfully. I've been lucky. My brother-in-law, Gidon Lieberman, is a leading specialist in women's health in London. And here in the Northeast, my colleague, Dr. Trish Davis, is also doing outstanding work. If I hadn't had the early exposure to this field as a young doctor, I think a lot of my patients would have had a much rougher time around surgery. So here's the key points. Hormone replacement therapy, or HRT, is prescribed to ease the symptoms of menopause, and many of you are taking it in tablet form. But those tablets can slightly increase your risk of something called deep vein thrombosis, or DVT. This is a type of blood clot that can form after surgery. It's not common, but it's something we take very seriously, especially when you're having general anesthetic for surgery. Aesthetic surgery is functional and appearance surgery, so is not typically urgent, but because we have time to plan, we should always try to reduce avoidable risks for you as the patient wherever possible. That's why I give my patients clear advice on how to manage their HRT in the run-up to surgery. Often, I recommend switching from tablets to estrogen patches or gel, which deliver the hormone through the skin and don't carry the same clotting risks. This way, you can stay on your hormones and avoid the difficult symptoms that return when treatment is suddenly stopped. Going into surgery while coping with hot flushes, poor sleep, poor mental health, and poor mood makes recovery so much harder, and it's just not worth it. So getting the hormones right is not a small detail. It's a really vital part of this whole process for those that need it.